Hi, I'm Olivia Ellingson. I'm a PA student and I'm going to be taking your history today. And as I'm washing my hands, can you just tell me your name, date of birth, and your age?
James Ellingson, 12/6/63. I'm 61.
Okay, and what day is it today?
Saturday, November 1st.
Alrighty, and what brings you in?
I've had a really kind of knot in my shoulder blade, and it's causing some tingling in my arm.
Okay, and when about did that happen? Was it more like recently, or has it happened? Like, has this been a chronic issue?
Yeah, no.
Recently, so how many days ago would you say?
Probably a couple months.
Oh, a couple months ago.
That's why I finally decided to come in.
Okay, and what part of your shoulder again?
Right in between the muscle.
Right in between the muscles, so
Yeah.
you're saying shoulder blade area.
Yeah.
Okay, and when you say you're having these like episodes of tingling and pain and whatnot, how long are they usually?
It's just, it only might last for a few minutes and then goes away.
Okay, and would you say it's worse in the morning or worse at night?
No, just in the middle of the afternoon.
In the middle of the afternoon? Okay, is there anything that makes it better?
Well, I've taken ibuprofen for the knot in my muscle. I suppose that makes it better.
Okay, and is there anything that makes it worse?
Well, I stopped doing push-ups and stuff, so that would make it worse.
Gotcha. And is there any pain that radiates or tingling that radiates anywhere besides the shoulder?
Oh, yeah, into my arm.
Okay, into your
my arm, yeah.
Okay, and would you describe what kind of pain is it? Is it more of a dull ache? Is it more of a sharp pain?
It's just like a Charlie horse.
So more of like a cramping?
Yeah,
okay.
Cramping.
And would you say, if you were to rank this pain or severity of the pain on a scale of 1 to 10, 10 being the worst, 1 being not at all, how would you rank it?
Like a 3.
Okay, gotcha. And have you had any issues with this previously at all? Any episodes? This is the only time it's happened? Okay.
Yeah.
And are you having any other associated symptoms with it, like in pertaining to the back or any other parts of the arm?
No.
Okay, and then are you having trouble with like retracting your arm or any sort of like range of motion with it?
No.
Okay, are you having any sort of like neuropathy or tingling or numbness, anything like that?
Just the tingling.
Just the tingling.
I just thought that was kind of strange that.
Do you have trouble?
That there'd be tingling for something in the middle of my shoulder blade versus my shoulder or my neck or something like that.
Okay, and does it wake you up in the middle of the night at all?
No.
Okay. All right, and so I'm just going to be moving on to some questions about your personal history. So have you ever had a history of blood pressure or diabetes?
No.
How about cancer or stroke or heart attack?
No.
How about high cholesterol?
No.
And how about cardiovascular disease?
No.
Okay, and have you ever been hospitalized for anything?
No.
How about any past surgeries at all?
No.
And have you had any childhood illnesses?
No.
And how about any immunizations, either recently?
Yes, I had a flu shot about 3 weeks ago, and I had a pneumonia shot about 3 months ago.
Okay, perfect. And how about any immunizations in regards to like measles, mumps, chicken pox, just like childhood vaccinations?
Way back when I was a child, I had all those vaccinations.
Gotcha. And how about, I do have to ask about pregnancy. Have you ever had any pregnancies?
No.
Any history of periods at all, or any issues with that?
No, I'm a man.
Okay, perfect. I'm just gonna move on to your sexual history. So what is your gender preference?
Male.
Male. Okay, and how about your number of partners?
1.
One partner. And have you had, you've never gone on birth control before or any sort of contraceptive?
No.
No. And have you had any history of STIs?
No.
All right, so have you had any sort of trauma or sort of injuries or been in any like abusive relationships, sort of any violence, anything like that?
No.
No. And how about any sort of transfusions? Had any sort of transfusions? Have you gone through any depression or anxiety or been diagnosed with anything like that?
Mm.
Okay, and I'm just going to go ahead and ask about some medications and allergies. Are you taking any medications right now besides the ibuprofen that you already told me about?
I take Flonase in the spring for alder pollen.
So
allergies.
just seasonal allergies?
Just seasonal allergies,
Okay,
yeah.
gotcha. And you said you mentioned ibuprofen, so what milligrams and how many times a day would you take that?
I just take probably 300 milligrams when I really feel that,
Oh,
sort
gotcha.
of, like,
So-
help sleep maybe or something
Okay,
like that.
so maybe just like 1 or 2 times a day, so not very often.
Once a day. Probably.
Okay. And how about any screening tests? Have you been screened for mammogram or colonoscopy or bone density, anything like that?
I've had a colonoscopy before.
Okay, just a normal, okay. And there wasn't any complications
Nope.
or any findings with that? Okay.
Nope.
And I'm just gonna go and move on to just your personal lifestyle and habits.
Okay.
Do you smoke at all?
No,
No. How about any, do you drink any alcohol?
very little.
Very little? Okay, so
Yeah.
just, how many times a week or month would you say?
A beer once a week maybe.
A beer once a week? Okay. And what would you say, what size? 8 ounces, 16 ounces?
12 ounces.
12 ounces? Okay, so really just like a social drink and
Yeah.
not super often. Okay. And any recreational drug use at all?
No,
And do you exercise on a consistent basis or?
mostly just walk.
Walk? Okay.
Yeah.
And how about sleep? Are you getting a good amount of sleep each night? How many hours would you say?
Probably 6 hours.
6 hours of sleep?
Yeah.
Okay. And do you wear like your seatbelt while driving?
Yes.
Okay. And like if you were to ride a bike or anything like that, would you like always wear a helmet just like as a
Yes.
safety precaution?
Mm-hmm.
Okay, perfect. And I'm just gonna move on to your family history. So, and this is just like within your close family.
Okay.
So do they have a history of cancer or high blood pressure or heart attack?
No.
And what about a stroke or cardiovascular disease?
No.
Or high cholesterol?
No.
Okay. And how about the, is there any significant history of disease that someone in your close family has passed away from that is pretty prevalent
No.
or major? Okay. All right. And then just moving on to your personal and social history. Are you married? Do you have,
Yes.
Okay. And, so are you living at home? What's your living situation like?
Living at home, and we have.
Do you live in an apartment or a house
We
or?
live in a house,
Okay.
and it's my wife and I with our 3 kids at home now.
Okay.
3 of our 4 kids.
3 of the 4 kids, and
Yep.
And do you have any pets at all, or?
Yes, we have
Okay.
a dog.
Okay. And how about finances? Do you have any like stressors in finances, or is that?
Sometimes.
Mm-hmm. But for the most part, would you say that with your home, are you still
Yeah.
comfortable? And that's
Yeah.
not okay.
Yeah.
And how about education-wise? Did you go to school at all?
Yes. I'm a
Okay.
college graduate.
College graduate. What
Mhm.
degree did you get?
Business administration.
Oh, okay, nice.
Mm-hmm.
And so with your occupation, or are you near any like bodies of water or factories or any sort of like anything prevalent, or just kind of in like an industrial city area?
I'm in a office building that
Okay.
has a shop attached to it.
Okay. And what about leisurely activities? What do you like to do outside of work?
Go to movies.
Okay.
I don't know. Golf. I like to golf.
Okay, good.
Yeah.
Good.
That's about it right now.
Okay, nice. And are you religious at all?
Yes.
Yes.
Mhm.
Okay. And you said there's no sources of stress like long term. Are you dealing with anything significant like
No.
that? No. And just touching up on any relationships or anything else in your life, and you're not having any sort of like abuse or violence or anything big like that. Okay. All right. And how about any sort of functional or troubled, you're having trouble with certain things in your daily life? Like, are you, like with certain normal activities, are you having trouble performing those?
No.
Okay.
No.
Okay.
Everything's good there.
All right. Well, thanks for letting me take history.
Okay.
That's all.
Thank you.